Dr. Jayadevan, if I can get you in, it's heart-wrenching to hear Dr. Ashwin, because look at what he is saying. Dr. Ashwin is saying, when I am doing my duty as a doctor, I expect the least that there would be a doctor doing the duty towards my family. That's not an irrational demand. That is as rational as it can get. That's as rightful as it can get. In this case, it's a doctor's family. In another case, it could be anybody else's family, Dr. Jayadevan. What are we really looking at?
Yes, as I mentioned, I must thank Dr. Ashwin for bringing this issue to focus, and also to thank you for giving it the importance it has deserved. The point here is the issue of trust. See, patients do not go to the hospital for fun. You go to the hospital as a last resort when you can't get better on your own, or when you have an emergency. And we enter the hospital expecting that the person who is receiving us is a qualified nurse and a qualified doctor and a qualified technician. If these are not happening, and then there is a loss of trust. And loss of trust can have severe consequences. And I don't have to elaborate on that. So I think this must be an eye-opener for...
But Dr. Rajiv, one question can I ask you? While Dr. Ashwin is saying that they will go ahead with criminal case against the hospital as well as this particular doctor, we have reached out to the hospital in this case. Is IMA going to... how is IMA going to help in this particular case? In Dr. Ashwin's case, there are many on social media who are saying he should go ahead with a legal case. But a legal case is also extremely daunting. One is really battling the loss of a family member, of a dear family member, and then one has to take a legal recourse as well. How is IMA positioning itself in this case?
Yes, the Indian Medical Association is deeply concerned about this incident. And even in the past several months, the association has sent out repeated reminders and circulars to medical institutions to look out for fake doctors who might be drifters. They may be drifters, and they may talk impressively, and they come up to you. They come up with real-looking credentials. To watch out for them, and also to verify each individual's credentials before hiring them. This is a problem not only in Kerala but also elsewhere, and we will continue our campaign to make sure that doctors who are legitimate will be seeing patients, and also we are concerned that qualified doctors. There are so many qualified doctors in Kerala, many of whom are unemployed, and instead of such doctors receiving Dr. Ashwin's patient and treating him, he received care from somebody who hasn't passed an MBBS course. So that is also a matter of great concern to us.
Dr. Ashwin, I have a question to ask you. I spoke to TMH Hospital, and they, of course, did not send us a representative. I asked them if they would send a representative to the show. We were doing a show at 6:30. They did not send anybody, but I spoke to them. And the gentleman whom I spoke to told me that they had asked for a registration number. They got the registration number. He was asked for his certificates. They got the certificates. And that he is a medical practitioner who has practiced as a doctor in several hospitals. And they had that in the case proof, and they got to know of the quote-unquote ineligibility only after your case came to the fore. And they've also said that it's only one backlog paper that's left. How do you react? What's your response to this reaction from the hospital?
Ma'am, ये जैसा आपने शुरू में बताया था, ये काफी स्ट्रॉन्ग एलिगेशन है. हमने जो डॉक्टर नाम अपने आप को बताते हैं, ये जो मिस्टर अबू अब्राहम लूक जो है, हमने काफी अपने लेवल पे इन्वेस्टिगेट करके पता किया है कि दिस पर्सन हैजंट क्लियर्ड हिज एमबीबीएस सेकंड ईयर. शायद हो सकता है वो वाला सेकंड ईयर वाला एग्जाम में उनका एक पेपर का बैकलॉग होगा. सेकंड ईयर पास होने के बाद एक थर्ड ईयर का एग्जाम है, फाइनल ईयर एग्जाम है, उसके बाद एक कंपलसरी 1 ईयर का इंटर्नशिप है. ये सब कुछ करके मैं यहाँ पे आज एक एमबीबीएस एमडी डीएम का फाइनल ईयर वाला डॉक्टर बैठा हूँ. उन्होंने अपना एमबीबीएस सेकंड ईयर का एग्जाम पास किए बिना मेरे पापा को कैसे देख सकता है? एंड हु इज रिस्पॉन्सिबल फॉर चेकिंग द वैलिडिटी ऑफ द डॉक्यूमेंट विच हैज बीन सबमिटेड टू द मैनेजमेंट? ये मेरा काम नहीं है ना. मैं वहां पे मैं अपना पापा को लेके जब जाऊंगा या मेरी मम्मी को लेके जब जाऊंगा, मैं वहां पे जो ड्यूटी डॉक्टर है उनसे ये तो नहीं पूछूंगा कि आपका डिग्री वैलिड है कि नहीं, आप MBBS डॉक्टर है कि नहीं, एक ट्रस्ट के ऊपर हम वहां पे लेके जाते हैं अपने पेरेंट्स को या अपना रिलेटिव्स को, एंड वो ट्रस्ट आज ब्रेक हुआ है। वो मेरा रिस्पॉन्सिबिलिटी नहीं है, वो मैनेजमेंट का रिस्पॉन्सिबिलिटी है, आम जनता का रिस्पॉन्सिबिलिटी नहीं है। वहां पे जो डॉक्टर है उनका डिग्री वैलिड है कि नहीं वैलिड है। वो कैसे बोल सकता है कि सेकेंड ईयर सिर्फ एक सब्जेक्ट का बैकलॉग है? इवन वन सब्जेक्ट का बैकलॉग भी उनको डॉक्टर बनाने से रोक के रखा हुआ है। जब तक वो डॉक्टर नहीं बना हुआ है, हाउ कैन ही मैनेज ए पेशेंट इन द इमरजेंसी डिपार्टमेंट? रात को कोई इमरजेंसी डिपार्टमेंट में जाता है, उसका मतलब है कि इतना ज्यादा उनको दिक्कत हो रहा है, तभी जाके वो हॉस्पिटल गया हुआ है। थोड़ा बहुत भी वो वेट कर सकता है, वो सुबह जाते हैं। रात का 4:30 कोई, अर्ली मॉर्निंग सुबह 4:30 कोई जाता है हॉस्पिटल, उसका मतलब है कि उनका जो कंडीशन है उतना ज्यादा क्रिटिकल है, तब जाते हैं। जो जो जिस टाइम पे सबसे एफिशिएंट डॉक्टर का जरूरत है एक इमरजेंसी डिपार्टमेंट में, और उस टाइम पे इन्होंने एक MBBS सेकेंड ईयर स्टूडेंट को लगा के रखा है। और हमें ये पता चला है कि पिछले 4 साल से वो उसी हॉस्पिटल में नाइट ड्यूटी करते जा रहे हैं। तो वो 4 साल में कितने लोगों का डेथ इनकी वजह से हुआ होगा? आगे कितने लोगों को मारने वाले थे? अभी तो ये पता चल गया, तभी जाके ये रुक गए हैं। अदरवाइज he would have continued to practice the same way. I even came to know that he did not even attempt his MBBS second year exam when he was given a chance a few months back, because he was already earning. There was
Dr.
no
Rajiv
impetus for
Jaydevan?
him to write the exam.
Yes.